Porn addiction is often a loosely used term, and identification and management of an actual porn addiction case may take months, if not years. I'll break porn addiction down to its statistics, causes, signs, and treatment options. Here are a few statistics about porn you should know. 25% of all online searches are related to sex, 35% of all internet downloads are pornographic, 70% of men aged 18 to 24 years visit a porn site at least once a month, 88% of porn scenes contain physical aggression, whereas 49% contain verbal aggression, 1/3 of internet users who consume porn are women, and the largest consumer group of online porn is men aged between 35 and 49. Now, not everyone who watches porn is a porn addict. Porn addiction affects 5 to 8% of the adult population. On average, a porn addict will consume 11 to 15 hours of porn per week. The increased exposure of children to porn is a real cause for concern. You'd be surprised to know that the average age of first exposure to porn is now only 11 years, and 93% of boys and 62% of girls have viewed porn at least once before turning 18. And why is that? It's so easy. You go to a porn website and just click claiming to be 18 years or older, and you can really watch all the porn you want to watch. The interesting thing to note about porn is that it has the power to influence your sexual preferences over time. And if you're a porn addict, make you completely unresponsive to regular sex. How does that work? It's all about dopamine. Dopamine is a neurochemical that is released every time you perform an activity that's going to help you or your DNA survive. So dopamine is released when you exercise, when you eat healthy, and also when you have sex. The dopamine rush is typically experienced at the time of orgasm. That's nature's way of telling you you're doing a good job, keep doing it. In porn addicts, the same dopamine rush is experienced in response to porn, but it is not experienced in response to regular sex. And that's where the problem is, because just like muscles, which bulk up when you exercise, the brain also works on a use it or lose it phenomena, which means that over a period of time, the brain trains itself to strengthen the connections that trigger the dopamine response to porn and weaken the neural connections that trigger the dopamine response to regular sex. It is this unnatural conditioning of the brain that causes porn addicts to become completely unresponsive to regular sex. So what factors contribute to porn addiction? These factors can basically be divided into biological, psychological, and social factors. From a biological perspective, as you might expect, higher levels of sex-related hormones like testosterone in men and estrogen in women predispose the person to excessive or compulsive porn watching. If you have a genetic predisposition to sensation-seeking behavior or impulsivity, you are also at risk of developing porn addiction. In addition, if you're genetically predisposed to developing anxiety or depression, that also correlates with porn addiction. Psychological factors include mental health conditions such as depression, anxiety, poor impulse control, and personality disorders. Also, early exposure to porn as well as childhood sexual abuse contribute to the underlying traits involved in porn addiction behaviors. Social factors include social isolation due to rejection in relationships and social circles. This leads the person to engage in unhealthy sexual behaviors and also predisposes the person to anxiety and depression, which further contribute to the development of porn addiction. It also includes peer group influence. Humans are social animals. We do what we see others doing. So if in your peer group there are others who are consuming a lot of porn, it's likely that you will too. Let's now look at the 10 signs of porn addiction. Number 1, you can't stop. Despite repeated efforts of you trying to curtail your porn viewing, you simply cannot fight the urge to go online and watch porn. If your partner can't stop, you'll see that they're spending more and more time on the internet despite you trying to communicate with them about the same. Number 2, you want more. Just like drugs and alcohol, porn is a drug unto itself, and it causes craving every time you go without it for a considerable period of time. For porn addicts, the porn fix is essential to get high. If your partner is addicted to porn, you'll see that they start sneaking to the other room every time they go without porn for a few days. If you confront them about it, they may also start acting defensively. Number 3, you've lost time. Porn addicts end up spending most of the day watching porn without doing anything else. They may seem like they simply don't care and are completely uninterested in anything else besides porn. You will also notice that someone with porn addiction is always lethargic and has not accomplished anything much as of late. Number 4, you're completely disinterested in sex. This is because of the use it or lose it phenomena I told you about earlier. Porn addicts will often reject their partner's advances towards them. They will also seem distant and sometimes completely uninterested in sex. Porn addicts will also require more than normal stimulation to enjoy regular sex. Number 5, you're more demanding. Porn addicts develop unrealistic attitudes towards sex and therefore they're more demanding and easily frustrated in the bedroom. You insist that your partner watch porn and act out porn fantasies even though they don't want to. Number 6, you've lost attraction. Porn addicts also develop unrealistic attitudes towards the beauty of their partner, which may make them feel hurt and manipulated. They're also unable to orgasm without first viewing porn, which reduces the sexual attraction towards their partner further. Number 7, you're in physical pain. Be it from the physical movements involved when viewing porn or the strain that comes from excessive computer use, porn addicts will often complain of headaches, neck, back, and wrist pain. Number 8, you're losing money. People suffering from porn addiction often start spending money on what they consider to be higher quality content, and this drives them into the trap of mindless spending. Number 9, you're distracted. If you're a porn addict, it's very likely that you've distracted yourself from all other aspects of life. You've alienated your friends and family, and it is probably also affecting your work life. And number 10, you're angry. Just like any other addiction, someone with porn addiction will become easily agitated, irritable, and may also lash out at their partner if they go without porn for a certain amount of time. In fact, their partners often complain that their partner is not the same person anymore. So what can you do at home to get out of this trap? Delete all electronic porn and bookmarks from all your devices. Discard all hard copy porn. Call someone over, have them install an anti-porn software without giving you the password. When you have urges, plan out activities that will help you divert your mind from porn. Also, writing down really helps. Write down about the triggers that cause your urges, when you have these urges, why you have these urges, what you're doing about them, and how it's changing your life. Partner up with someone who can hold you accountable. And lastly, don't give up. Just because you failed once doesn't mean you won't succeed. Keep trying and eventually you will succeed. If you're unable to manage your porn addiction at home, the next step is to consult a mental health professional. Porn addiction is often accompanied by mental health conditions such as depression and anxiety, and the medications that help manage these conditions will also reduce sexual cravings associated with porn addiction. In addition to these, a novel drug naltrexone, which is also used in opioid disorders and alcohol use disorders, has shown a lot of promise in the treatment of porn addiction. Besides these, there are newer drugs that are coming up and have shown great promise. For all of these drugs, consult your psychiatrist and do not try to self-medicate. Other than medications, you can also take help from psychotherapies. A psychotherapy session typically lasts 30 to 50 minutes and a full course includes 12 to 20 psychotherapy sessions. In cognitive behavior therapy, the focus is on your thoughts, emotions, and behaviors and how they're related to each other. In motivational interviewing, the focus is to help you make a decision if and when you're ready to make a change in your life. In mindfulness-based therapies, the focus is on mindfulness or present-focused and non-judgmental attention. In psychodynamic therapy, the focus is on going back to childhood experiences and how they've changed your patterns of behavior. Knowing your patterns can also help you change them. In 12-step recovery-based therapies, the focus is on acknowledging your powerlessness over your addictions and seeking help from a higher power. And in couples counseling or couple therapy, all of your interpersonal relationship issues are sorted out. Okay, so this brings me to the end of the video. Thank you for watching this video till the end. Take care of yourselves.